of AIDS funding to fight the epidemics in the region. In Thailand, the national budget provides 83% of the funding for HIV programs. In China, public money also represents the vast majority of the funding. Other nations, such as the Philippines, have been more dependent on international assistance. Poorer countries, such as Cambodia, depend heavily on foreign aid. The same is true with Laos, where 99% of the money comes from abroad. Currently, most data is maintained and collected by governments or global institutions. This information can be hard to access or even understand. This is why several regional institutions such as the Asian Development Bank, UNICEF, UNAIDS and other co-sponsors have created the HIV and AIDS Data Hub for the Asia Pacific. This is a one-stop shop for all the HIV data in the region, a repository of HIV-related facts and figures from 27 countries, including Hong Kong and the Pacific region.
Now, why a regional data hub? We have already data at the national level which are collected. So you may ask, okay, we have already the governments doing that, so why do you need a regional data hub? First, we are stronger if we advocate together. So the easiest way to start discussing and dialoguing among the governments and the National AIDS Council, etc., is by collecting data which we share at the regional level.
Sometimes it's really hard to get data at the country level. The community, it's really hard for the community to access the data at the country level. It's so complicated, the red tapes, the bureaucracy, they will ask letter, why do you need the data and stuff. And the importance and the benefit that the community can get from the AIDS Data Hub is that they can access their country data in that website, so they don't have to go to other data source.
The biggest data gap we have in the region is that we don't know the size of the populations that are at risk of HIV infection in the different countries. And when we don't know how many people, then it's very difficult for programs to know how many people they need to address.
Actually, in East Kalimantan, the database management system for the province, it's poor. We have only 10 people living with HIV/AIDS for the last at least 4 years. The AIDS Commission, they claim that there are at least 900 people with HIV/AIDS in East Kalimantan. And the data never changed for the last 4 years. It still has 10 people for HIV positive. I don't know why.
The key affected population has always been seen as receivers. They have not been seen as contributors to the entire epidemic in these 20 years.
Sex workers are good sources of data as well. So they are not only recipients of data, they are also sources of data that can be factored into program planning and implementation. Sex workers know exactly how condom use can be consistently and effectively used among their groups. Sex workers are the best source of data. They know who their clients are, where they reach their clients, how often they interact with these groups of clients. So I think that they are the most reliable source for that.
We're trying our best effort just to make the government wake up. A wake-up call for the government is with the number. But the number in the national level, once again, is so little. For us, it means every number counts is a life of a person.
The AIDS Data Hub provides free online access to HIV data. Data on HIV epidemiology, vulnerability and risk behavior factors, the socio-economic impact of the epidemic and the responses to it are provided in a user-friendly format. Policymakers, non-governmental organizations, researchers and the media can find country and regional reviews containing the most updated information. In-depth information is also provided on men having sex with men, sex workers and injecting drug users, access to treatment and on the prevention of mother-to-child transmission. Users can easily find information about the current HIV and AIDS situation in the form of maps, spreadsheets, tables and graphs, as well as easy-to-understand narrative reviews of country or regional situations, key indicators, resource investments, trends and projections. In addition, about 2,000 reference materials such as surveillance reports and population-based surveys are also available online. As such, by promoting the use of strategic information, the AIDS Data Hub also acts as a regional platform that strengthens the dialogue among stakeholders and improves the quality of the data and its analysis. Ultimately, the mission of the AIDS Data Hub is to support national authorities and their partners in the provision of effective, evidence-based responses to those infected and affected by the AIDS epidemic in the Asia-Pacific region.